Hello, my name is Caitlin Warren. This is going to be my medication administration checkoff video. So I'm going to go ahead, I'm going to scan my room. I'm going to scan my desk. So the first thing I'm going to do is I'm going to make sure that I'm following my hospital's no interruption zone policy. So I'm going to not take any personal phone calls or text messages. I'm going to put myself in a quiet room and limit any interactions to essential information only. I'm going to compare my patient care order form to my MAR. So I have Jaguar Day Jones, date of birth 08/25/1963, 08/25/1963. Medical record numbers 417-6352, 417-6352. That's the same medical record number on both forms, and his allergy is penicillin. Today I will be administering his morphine. So I have morphine sulfate, 5 milligrams, IM, every 4 hours, PRN pain. So I have everything I need on here for a legal prescription. So I'm going to move this to the side. Now I'm going to begin my first check. So I'm going to go ahead, I'm going to wash my hands, perform hand hygiene. So I have my morphine sulfate. 10 milligrams per milliliter. Expiration date is 12/20/2025. And it's not expired. So for the dose, this is 10 milligrams per milliliter. So I'm going to be administering half a milliliter because I only need to administer 5 milligrams. So I'm going to be double checking that calculation with another nurse. I'm going to give it intramuscular. So I'm going to select my 3 milliliter syringe. And I'm going to give it every 4 hours. It's been 4 hours since his last dose. Indicating pain, and he did indicate pain by 7 on the scale. And I have Jaguar Day Jones, which is my patient, and I have everything I need on here for a legal prescription. So I have the medication, the dose, the route, the time, the indication, the patient, and everything I need for the right documentation. So now I'm going to perform hand hygiene again. I'm going to take an alcohol prep pad, and I'm going to clean the top of my my vial. Perfect. Okay, and now I'm going to take my syringe, and I will be putting a blunt tip cannula on the end of it. Following sterile technique. Okay, and then I'm going to be pulling back half a milliliter of air into my syringe, and I'm going to inject that into my vial. To make sure there's no air bubbles. Perfect. Just kidding, there was one. Okay, so I'm gonna make sure there's no air bubbles. I'm going to take my syringe, and I'm gonna use the scooping method to scoop it. So I have half a milliliter. there's an air bubble, sorry. I have 0.5 milliliter. Okay, so now I have my medication. I have morphine sulfate. I have morphine sulfate in my syringe. This is going to be my second check. I have 0.5 milliliter, which is going to be 5 milligrams. I have 0.5 milliliter in here. IM, that's what the syringe is for. Every 4 hours. It's been 4 hours, indicating pain. He indicated pain. I have my patient, Jaguar J. Jones, and then I have everything I need for the right documentation. So now I'm just going to create my label for my syringe. And on this label, I'm going to write the patient's name, the medication, and the dose. Jaguar Jones. So I have morphine sulfate, morphine sulfate, morphine sulfate in my syringe. And I have 5 milligrams. Okay, so there is my label. So I have Jaguar J. Jones, morphine sulfate, 5 milligrams, or 0.5 milliliter. I don't think I need to write 0.5 milliliter. I feel like that might be a little confusing. So I'm just going to rewrite my label. Yeah, that's fine. I'm going to rewrite my label and just put his name, morphine sulfate, and then 5 milligrams. I'm pretty sure it would have been fine, but I just want to double check and be safe. So there we go. I'm going to put this on my syringe. Okay, so now I'm going to put my 23 gauge needle on the end of my syringe. And I'm going to dispose of my blunt tip cannula into my sharps container. Alright, so now that I have completed my second check, so I did my morphine sulfate, 5 milligrams. I have 0.5 milliliter for 5 milligrams. Intramuscular, it's going to be this IM injection right here every 4 hours. It's been 4 hours since his last injection. For pain, he indicated pain. I have the right patient, Jaguar J. Jones, and everything I need for the right documentation. So I'm going to take my vial, my syringe, my MAR, and I'm going to go to my patient's room. Alright, so I have my patient. I'm going to perform hand hygiene. Hi, Mr. Jones. How are you today? I'm going to go ahead and make sure I have the right patient. So I have Jaguar J. Jones, date of birth 0825-1963, 0825-1963, medical record numbers 417-6352, 417-6352, and he has an allergy to penicillin. Do you have any other allergies besides the penicillin I should know about, Mr. Jones? No? Okay, perfect. I note that you did indicate a pain score of a 7, so I'm going to go ahead and perform my pre-assessment before administering your morphine. So I'm going to check his heart rate and his respiratory rate, and then his pain scale. So now I'm going to go ahead and lower the side rail, put the bed at a comfortable working position. I'm going to select an IM site. So for this one, I'm going to be using my ventrogluteal site, and I'm going to be putting the patient in a supine position, a lateral line position facing towards me. I'm going to place my right hand on the heel of my right hand on the patient's left greater trochanter. I'm going to put my thumb towards the groin, my finger towards the anterior superior iliac spine, and my middle finger towards the iliac crest, and it's going to create a V. That's going to be my injection site. This is the preferred injection site for IM injections. So I have my pad. I'm going to go ahead and perform hand hygiene. I have my goggles on. I'm going to put on a pair of clean gloves. All right, and I'm going to begin my third check. So I have my vial right here. I have my syringe. And I have my MAR. So I have Jaguar J. Jones, Jaguar J. Jones, Jaguar J. Jones on my syringe. I have morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate is what I put in my syringe. 5 milligrams. I have half a milliliter in here, which is going to be 5 milligrams since this is 10 milligrams per milliliter. Every 4 hours. It's been 4 hours. I have an IM, which is what the syringe is for. As needed for pain. He's indicated pain. I did my pre-assessment. I have the right patient. And I have everything I need for a legal prescription. So I have the medication, the dose, the route, the time, the indication, the patient, and everything I need for a legal prescription. So now I'm going to take an alcohol swab. I'm going to clean my injection site. I'm going to get another swab. I'm going to take my syringe. I'm going to spread the area, and I'm going to inject at a 90-degree angle. So I'm going to spread the area, inject at 90 degrees. I'm going to aspirate for any blood. There's no blood. So now I'm going to inject slowly. I'm going to remove my needle, put it in my sharps container. I'm going to take my alcohol pad. I'm going to apply pressure. Okay, and then I'm going to go ahead and put my patient back to the lowest lying position. I'm going to raise the bed rail on the side, leaving one towards the bathroom down. So I have 3 bed rails up, bed down at the lowest position. I'm going to document the time, the dose, and the medication. I'm going to document my pre-assessment, and I'm going to come back in 30 minutes and assess my patient and see if his pain has gotten any better. I'm also going to document how he tolerated the injection. And that is my procedure.